Hello, welcome today. We are so excited. We have a really special edition for the Journal of Trauma Nursing with our leaders in the Journal of Trauma Nursing, our editor-in-chiefs through the past 30 years. So today we're going to be talking with Eileen, Catherine, and Judy to talk about the past, present, and maybe even a little bit about future plans with the Journal of Trauma Nursing. We're just so excited to have you all here today and to discuss. With that, I know everyone's here to hear you all speak. So I'm going to give it over to Eileen to give some, just kick us off.
Well, thanks. It's really a pleasure to be here, and I considered it quite an honor. I considered it quite an honor 30 years ago when we started the Journal of Trauma Nursing, and it might be kind of fun to think back about some of that history. So it used to be that so at the time, I was a trauma nurse coordinator, was our title, in Orange County, California. I moved up to San Francisco General. But we had two trauma conferences, North and South, every year. And the General sponsored one, and then the trauma coordinators in San Diego, Orange County, sponsored the other. And this is really the origin of many of us coming together to even develop the Society of Trauma Nurses. And then it was a whole group of people with a vision, again, peers in trauma, that thought we really should have some kind of peer-reviewed journal. What you might not remember is it started off as a newsletter, and the newsletter was published in my spare bedroom in Sacramento, California. I lived in Sacramento and drove back and forth to San Francisco to work at San Francisco General. But we started it off as a newsletter, and Peg Friedland, who was my partner in crime, and Connie Yastrzemski. And this will bring a laugh to all of you. Connie was listed as the editor-in-chief because she had a graduate degree and Peg and I did not. So there's a little piece of history you may not know.
Boy, classic nursing, yeah.
Exactly. And Connie was a mentor of mine when we were back at the shock trauma unit in Maryland. So she was really very, very involved early on, and quite inspirational to all of us to really get this organization as well as the journal up and running. But years later, obviously, I did get a graduate degree. And Connie said, you guys are doing a great job. There's no reason to have my name on this any longer. And she moved on, and Peg and I took it on. But truly, it started in the spare bedroom of our home in Sacramento. I can remember taking the copy on a disc to a printer. Now, can you imagine that? I mean, who did that? So thankfully, technology has changed greatly. And
Wow.
I can remember having a friend who was a person who did logo design. And I sat in her kitchen over a bottle of wine, and we designed the logo for the front cover of the journal. And I was just on the website looking at the logo again, and it's almost the same. It really hasn't changed that much in the 30 years. So just a little humor. But it was truly a group of us. I can remember sitting in the conference room in the Department of Surgery at San Francisco General when we all said, are we in or are we out? Because if we're in, it's going to require multiple people to go out and really flush out the research, flush out the manuscripts. And we set some very specific expectations of those people who really wanted this to happen so that they could inspire their staff, their colleagues, physicians they worked with to really help us develop those manuscripts. But it was tough going because at the time, not many people were writing about trauma or feeling that confident in their writing about trauma nursing at the time. So that's my little bit of history.
Amazing. It's great to hear how it all started. And I think sometimes we all miss that as viewers, right? I've been reading the Journal of Trauma Nursing for years now, and then to meet all of you and then find out where it starts, it's fascinating.
Well, and we developed an editorial staff based on commitment. So people were placed in those roles because we knew that they were sort of the people that were making waves around the country as early trauma program managers. And they could work with various teams across the country to try to get those manuscripts. Alice Gervasini out of Massachusetts, Mass General. I mean, some of these people, these are iconic trauma folks. Kathy Martin, of course, was very involved. Kate Fitzpatrick, who is still very involved. And it was a lot of fun. It was a lot of work and a lot of stress, quite frankly, trying to set self-imposed deadlines, trying to come up with a budget for it, and then more importantly, trying to come up with reasonable content.
And I know we're talking about the Journal of Trauma Nursing, but at the same time, all of you leaders also served on the Society of Trauma Nurses, right? In leadership roles.
Yes, yes.
I think that's the fascinating thing. When I looked back at what the early leaders did, they all were serving in like 5,000 positions all at the same time, wearing different hats and writing for the journal and or being the editors. So they were, presidents, past presidents, president-elect, and doing the journal, speaking at the conferences. I mean, they literally lifted this thing off the ground with their bare hands. I mean, talk about grit. It just, I'm doing one thing, I'm doing the editor position and I'm having a heart attack. And then I'm looking back and seeing all these people doing, 17 things at the same time. It's quite remarkable when you look back at it. You probably didn't realize it, Eileen, at the time. You just did the work,
Well, one of the memories I was thinking about today about the journal and about the organization, we had really some significant conflict with other professional nursing organizations who did not want to see the Society of Trauma Nurses succeed because they were very worried that we would take membership away from their organizations. And I think back and laugh now, all these years later, about meetings with the leadership of ENA, for example, leadership of the critical care organizations, perioperative groups, just to say, hey guys, we are all complementary. We all have the same professional goals in mind. And now I look at the website, look at the success of Society of Trauma Nurses and think, wow, well, it's just pretty amazing.
Yeah, and a little humor there is that today there are so many journals coming online. Every 5 minutes, there's a new journal of everything. So to think that they were worried about one group, that's rather interesting.
And when I came in, I kind of spanned a couple different organizations because I'm a perioperative nurse by my profession. So when I came in, thanks to Eileen and the other editors that worked on it, I kind of already came into something that was being produced. And what I brought was, while I wasn't considered a trauma nurse, I did do trauma OR because I worked in an OR for so many years, but I also had other jobs. And so I was an editor before. I edited a perioperative journal. I edited a couple other things so that I had done some editing. And so I brought a little bit of editor training in with me because I had done surgical services management in a perioperative nursing manual journal. And then when I got contacted about this position, I thought, well, I love trauma. I love trauma OR. What's not to love about all trauma nursing? So to me, I never thought of it as a conflict, but I do see exactly what Eileen is saying. It's always like, oh, everybody's fighting for turf, but yet we all really work together when we're caring for trauma patients. It doesn't make a difference if you're in the OR, if you're in the ED, if you're on the unit, in the critical care, it's all trauma. So I thought this would be a wonderful journal. And the other difference that I experienced when I came on board is that the Society of Trauma Nurses had just contracted with a publisher.
Right.
So it was like, wow, this is exciting. This will be great. They have an actual publisher. So I kind of stepped in and was kind of a new era, because the first group, you all were kind of sorting through self-publishing, which is difficult, to say the least. But when you step in, when an organization itself isn't doing its own publishing, now you're contracted. Now they were contracted with Lippincott Williams and Wilkins Wolters Kluwer publishers. So it kind of led to the beginning of a whole new era.
And it was so necessary.
Yes. So that's what I stepped into, which I felt I was extremely lucky to be coming in on that, and I could bring my previous editing experience. I did have leadership experience as well. I was in various leadership roles in AORN. I was I was coming from the OR again.
Same thing, wearing a lot of hats.
But yeah, and I also, while I was doing my editing, I still worked in the OR. I still worked at the hospital. But I also, then I also did have that graduate degree that we talked about. And what that meant is I was also a professor in a college of nursing. So I had different hats. So I'm not only a professor in nursing, but I'm also still working in the hospital, and I'm editing a journal. So it is
Wow.
nurses juggle a lot. We always juggle a lot. That's just kind of how nurses are, I think. So
Well, and it was so important to bring you on when we did. Peg and I both, well, me personally, started into some very different career path, and really didn't feel that it was something I could continue with. And because we had been successful for those few years, it was really a phenomenal time within the organization to bring on a publisher and then bring on someone with your expertise. I can only tell you, Peg and I did a happy dance so many times. We did a happy dance with quite a few bottles of wine. So.
And then I picked up after Catherine, which you guys had built. It's like a stair step, I just inherited all this work that had done before me, which made it so much easier. And Catherine gave me such a great training. I have the benefit of using, the software that does so much more. When I think back in the old days, you didn't have that as well. So a lot of advantages that I'm sitting on based on the work that you guys did. But Eileen, I just can't even imagine like not having a computerized system to manage a journal. You must have been doing everything by mail. I mean, did people mail their manuscript to you? You'd open up the mail, read the article, make written notes and send it back? What did you do?
We did. It took months back and forth, and Peg and I split it up, and we'd send it back to an author. The author would take the time. And eventually, when we all agreed to the editing, it came in electronically. But everything then was saved in a Word document. And I mean, we didn't even have now we have the ability to edit on screen with work. We had none of that. It had to be handwritten. And you remember the whole term, Catherine, I'm sure you do, of redlining. You got so upset if you got a redline manuscript back because somebody took a red pen to your manuscript, but that's what we did. And ironically, neither Peg nor I, we had a heart and we had interest and we were totally committed, but had no professional editorial experience whatsoever. So again, it was such a great time for the organization to launch both with publishers and with professional editors. So I'm grateful for the time I had, but I think the success really is the leadership that continued.
Yeah, I think we went through a lot of change, and I came on board in April of 2006.
Wow.
And then JTN was published quarterly, and I think my first editorial was in the July-September issue of 2006. But you come on a little early because you're always publishing ahead. You always have to have your next couple issues ready in the queue to go. And I kind of thought, what things could I strive to do? And you try to get a feel for it. And then it was, as technology evolved, other things evolved. And over the years, I started focusing on having some themed issues. I think we might have had some, but we worked within the specialty interest groups, and we had some issues focused on pediatrics or advanced practice, or we had military, a leadership one, injury prevention. And that's a nice way to get a lot of journal articles all together in one group. And people then could all focus on just writing to their area of expertise within trauma nursing, which was kind of nice. So I did some of those issues as kind of a little thing to do, to change it up a little bit. And then I think in 2014 is when we transitioned from 4 issues a year. We were able to go bi-monthly to do 6 issues a year, and that was 2014. So I had been doing it for a while, but working up to getting a level of submissions. So you'd have a similar size journal for every issue that came out. And then I think when we switched to that, it was 4 hard copy issues, which is what they had before. But then we added 2 online only issues. So that was kind of that was something that we could do because of having the publisher and having the online JTN website. So we would have four issues that came out in hard copy and then 2 online only. So, but we were up to six issues a year, which was
You grew.
that showed growth in the organization and in our submissions and in our growth as a journal. And that was 2014. So that wasn't that long ago.
No, it's amazing.
And then once that happened, I made the jump to see if we could get an impact factor rating, because you have to have enough things coming in and to be cited enough to qualify for impact factors. So in 2015, I think, is when we got our first impact factor. So I was very excited that the journal had moved. It took some years though. It doesn't happen overnight, but we got it to that. We got to the impact factor rating, and I thought that was really a wonderful thing to do. And in addition, I don't know if Eileen, if you all had done this at past STN conferences, we did presentations at the annual conferences on writing for publication to try to, I did workshops. I'm sure that workshops were done. That helps the nurses because, as Eileen mentioned, not all nurses feel comfortable writing. It's like now to say, would you write a professional article? Oh, no, I don't know how to do that. But if you have a workshop for people and say, hey, here's how you get your ideas, and here's how you focus your ideas, and here's what you have to do, and we'll help you. And like you said, Eileen, I also was an editor who wanted to nurture new authors.
Mhm.
They have things to share, but they don't always feel comfortable sharing. Not all nurses just come out of nursing school thinking, well, I feel I can write for publication right now. So we help them.
In the early conferences, Catherine, you're absolutely right. And I can vividly remember we always had 2 lectures. One was on research and how to begin a research project. How do you even begin the thought process? And then the other was how do you develop a manuscript for publication? And Alice Gervasini out of Massachusetts always did the research conversation. She was expert, PhD, and did a significant amount of research herself. But you're right, we did. And another little known factor, I don't know where you are now with the conferences in terms of attendance. I can remember us celebrating when we had over 200 participants.
Wow.
I don't know the true number for this year's conference. It's going to be taking place actually in Colorado this year, in Denver in a couple weeks. And all I heard was it's the highest attendance numbers. And they warned moderators, hey, there might not be enough room for everyone in the rooms.
Wow.
Wow, congratulations.
Yeah, that's exciting. I saw, Eileen, that you guys had a first authors program. I was reading about that, how you would mentor a person and help them get their article into the journal. I mean, I think being an editor, we're all like cheerleaders. But there's a significant amount of teaching that goes on that I don't think people appreciate, that you really have to mentor people to write and help them. So it's an important role.
I still think about it. A young gal who worked in my quality department at University of Arizona. And she never thought she could write an article. And she wrote a beautiful piece. It was a piece that we were working on in terms of a quality project at the hospital, and just taking her through that process. To this day, we're both retired, but she still sends me notes saying, I'm a published author because of you. It was the first and only, but she did a great job. And it's just such a good feeling as an editor to see a young person go through that experience and come out so much more confident on the other end.
And Catherine, I know you have millions of stories like that. Catherine is just the proverbial cheerleader, always encouraging people to write. You really always were just such a warm, welcoming presence to anybody. I felt that when I wanted to write for JTN, talking to this editor was like this big deal. I mean, it was like, oh my God, she's actually a normal person. She'll talk to me. We are normal people. I mean, we all had to write our first article, which was probably abysmal, but we started and somebody helped us. And I guess that's what it's really all about even today. When I think of it, 30 years, this journal's been in existence, started by nurses, for nurses, read by nurses, written by nurses. So it's full circle. It's 30 years. And my hat's off to you guys for the work that you did to get us in this position. And I'm just proud as a peacock to be able to carry it on, and hope, as we talk about the future, just continuing to grow and keep the journal a good presence, working with other organizations who want to contribute articles. There's a lot of conferences where people present at conferences and then it's lost forever.
Right.
And I really think that anything that is presented at a trauma conference anywhere, whether it's pediatric trauma conference, adult, I don't care, that material needs to be in the journal. So I think one of my future goals is to really try to get things that are said verbally into writing. And
that was a technique. That was something we tried so hard, because you're absolutely right, Judy. People spent hours in preparation and research for a presentation, and distilling that down into a manuscript really is such a great way to memorialize the work.
yes, yes.
What I think is super fun right now is when I see look at references for articles and see that the articles being referenced out of the Journal of Trauma Nursing. To me, that is such a cool feeling.
Yeah, that is a good one.
It's beautiful. I think the impact factor that you all have been able to accomplish through mentoring others. I know, Catherine, you helped mentor me, years ago. And then now, not only nationally, but internationally, I'm seeing more and more international publications. And so just think of all the lives touched. You're inspiring others, and how that's helping impact patient care and outcomes. It's amazing.
It's a wonderful legacy. Yeah.
And I have to add that the fact that I teach nursing students is kind of has it's a pro and a con. It's good in that I'm able to share with them how to read journals, nursing journals, what to look for, and all that information. However, when they find out I'm an editor, and then they think, oh no, she's going to grade my class papers. It kind of gave them pause, because they know I really do edit a paper when I look at a paper. It's kind of like my school papers I look through just as seriously as I would look through a manuscript for a journal. But that's the eye of an editor. You read with a certain eye for something, so you can give good feedback to someone about a paper, and that helps that person grow, whether it's a student or whether it's a practicing nurse. It's just kind of a fun thing that I would say, oh, I'm an editor, and they'd go, oh no, my professor's an editor. She's going to really look at my paper. Well, yes, I am, because that's what editors do. But the other thing I brought was that I was able to. I finally left working in the OR, which I was sad about. I had my OR withdrawal for a while, because that was my area of nursing for 29 years. But then I transitioned into another role at the hospital, and I became a nurse scientist, which means I'm the nurse researcher that helps other nurses do research at the clinical research at the bedside. So that gave me the ability to talk research to people, and not only to teach research at the university, but also to teach research to nurses who want to learn how to do research and how to write up a research report. And I think that those skills that I had helped grow things as well, because of juggling so many roles. We all have so many different roles, and some of the roles can play into really well. And I think that really benefited me as an editor.
That's beautiful. It's really interesting to hear the history, and thank you all so much for all of your time. Before we hop off, I want to see what was the most memorable article so far for each of you.
Wow.
And I know there's a lot of good ones. So
Or maybe a couple. Yeah, anything that.
One thing that comes to mind very early on was the work at a Penn to really document the trauma registrar role, and the amount of hours, the amount of time, the expectations in terms of, again, entering from paper into a trauma registry. That was really helpful, I think, at the time for everyone to justify the role of a trauma registrar, and then to quantify based on the fact that you're level 1 with 4,000 patients, how many trauma registrars are you really going to need? And Kate Fitzpatrick was a lead author on that with Marla Venor, as I recall. To me, that one sticks out in my mind because it was clinical, operational, and incredibly helpful at the time for people to justify program growth.
You know, Eileen, in your era, I believe it's your era, the Dr. Steiner did that really wonderful article that was the basis of ATLS.
That's right. That is so right. Yeah.
Right. You want to just shortly explain that, what that
Oh,
was?
goodness.
I mean, he was,
I'm not
he
sure
was in a plane crash.
Oh,
and
gosh.
he's an orthopedic surgeon who was in a plane crash and crashed in a field. And that was back in the day when there was really no EMS, no taking you to a trauma center.
Right.
And based on the experience of his family, his personal experience, he really got the American College going and got ATLS started. So and that was in our journal. That wasn't in a surgeon's journal. That was our journal. And it was
I
a
do
first
recall
person
that.
story that really hits you when you read it.
Boy, you're bringing back a great memory. Yeah.
I think there's so many articles. I was in this role for 13 years, as you all were in for a vast chunk of time. And I try to think of what things, and I doing something like looking at the trauma registry position and the idea of growing that part of the profession of trauma nursing, it really makes an impact. I guess things I remember, maybe because it's always been so relevant, is nurses in trauma talking about their perspectives on moral distress and aspects of compassion fatigue, and how a trauma nurse would be right at the forefront of experiencing that issue. And I think we published some of the first manuscripts on that. It is clearly in the trauma area. And I think that was really helpful. Now everybody's publishing because we're all dealing with
Burnout. Yeah.
Burnout, moral distress, compassion fatigue. However, I think we had some really good articles that focused on that as well. And it was early on, in the early days. So I think that was something that contributed to the body of literature as well.
I think the article that I think of right now is one recently that was in the journal that was done on a huge volume of patients, and they were able to access Press Ganey scores and actually tease out the contribution of trauma nurses to the positivity in the Press Ganey, because there's always that, does patient satisfaction really matter? And ironically enough, in trauma, it's the trauma nurse that made all the difference. It wasn't anything else about the hospital, is the physicians, anything else. And that needed to be in the literature. So that was a great get, I thought. Good question.
I have so many for you, but we might have to do this another time. This is just awesome, just to get some insight in your time. And just, when I stepped into, nursing, Eileen, it was after you had stopped. It was, during Catherine and Judy's time, but, just that foundation that you've set, and then how, it's grown. It's just, I'm very grateful for it. I'm sure many others are too.
Well, Valerie, let me turn around and flip it at you. Having a digital editor is something that is a dream come true. Today, it's one thing to publish and have the print version arrive to your house, but I think the world has changed so much that if we aren't doing something with your role, you're making you take the same article that comes in the journal and you expand it to everything using social media. So it's a huge role. So tell us what you think about your role.
Oh, that's a great question. Thanks for turning that around.
Yeah, sorry.
I think very much what spoke to me is when Eileen was saying, we didn't really know I feel like this is still so evolving. When we sign, when we became nurses, we know we want to make a difference. And it's really the different ways we can't anticipate, we can't fully forecast the different ways we can help with that. So digital editing has been really interesting. What I really enjoy is getting to meet the authors, getting to know a little bit behind the scenes, and then working with Wolters Kluwer to get those connected with the articles so we can get a little bit more behind the scenes with those authors, and then just sharing the information, because as we know, there's so many people on social media, and our nurses are on social media. So to be able to just give them that access, a quick, maybe little brief introduction, a little podcast, if you will, with the author, and then they can read the articles, has seemed to be really well received. But I'm always looking for ideas, because we're figuring this out as we go. And yeah, it's been an
Well, we
incredible
thank
opportunity.
you for everything that you're doing, because it's just a whole nother role that takes the journal and makes it bigger and better. And we can't do it without you. So thank you.
It brings the articles to life.
Yeah.
When you hear the words of the author speaking to you, oh, a real person wrote this. It isn't just a name, blah, 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 RN, blah, blah, blah. After it's a real person, and here's what he or she has to say. I mean, I think it's wonderful.
Yeah.
I appreciate people being vulnerable. I got a lot more no's than yeses when I started several years back. Like, oh, no, thank you, not going to do this. And now I'm getting a lot more yeses. And I think that's, in relation maybe to all of us having to pivot and become more digitalized to, a lot more
Becoming
people
more
are comfortable.
comfortable. Yeah.
And then I just appreciate authors being vulnerable, being willing to share that personal aspect, because before you'd only see it at a conference. And
Well, I think it also, it connects a member to a resource, which I think is really, really important. They may not feel that they can access that person, but now you've brought the person more to life as an author, and the ability to immediately connect and share and either be mentored or learn from that person. It's excellent. So
yeah.
I appreciate the opportunity. I appreciate each of you taking this time today, coordinating all our different time zones and busy schedules. Anything else you would like to say before we turn this over to the viewers?
Happy 30th anniversary, everybody.
That's awesome.
Cheers.
Love it.
trauma
And still going strong.
Yeah. Trauma has been the foundation of my professional career, and the Society of Trauma Nurses really supported me at a time when I needed. And then the opportunity for me to continue my career in various different leadership positions, I really totally base it on my experience at the bedside as a trauma nurse.
Amazing. Wonderful.
Well said.
Thanks. Well, happy anniversary and congratulations, everyone.
Yep. Same to you.
Same to everyone.